Hello, my name is James Brunz, Dr. James Brunz with Orthopedic Institute. Thank you for joining us today for this webinar on advancing the treatment of pain, alternatives to pain medication.
Go ahead, sir. Click on this page here, then hit your button. There you go.
Okay. So today we're going to briefly talk about some different things regarding chronic pain, and hopefully this will help people to see what some of their options are for their own situation. And with that information and knowledge can hopefully have a more meaningful discussion with your physician at your next appointment. So first, let's talk about the types of pain. Chronic pain is, by definition, pain that has lasted for greater than 12 weeks or beyond the normal healing phase after an injury. And that can be divided into different types of pain. And the two main broad categories are mechanical and neuropathic pain. Neuropathic pain is pain related to the nervous system itself. So that's basically, in layman's terms, nerve pain that can manifest with or without any type of trigger. So it can get worse spontaneously. It can lead to, or also manifest as both weakness and numbness, pins and needle sensation, burning and shooting, stabbing pain. Now that's different than mechanical pain. Mechanical pain is more arthritis type pain. So a good example of mechanical pain would be knee arthritis, where the pain is made worse by standing and walking, and is improved when pressure is taken off the knee. And so, lots of people have chronic pain, and usually what determines whether or not they're going to seek medical treatment for this is your pain preventing you from being able to do your normal things around your house? Is it impairing your ability to work and be productive, to enjoy life by interacting with your family, and pursuing your hobbies, and those types of things? And if your chronic pain is interfering with all these different aspects of your life, then it generally is something that people seek treatment for. And most people with chronic pain have tried different things, various modalities. There's several that we employ, including anti-inflammatory medications, physical therapy. Obviously, there are certain types of conditions, pain conditions, that can be treated surgically. Nerve blocks and epidural injections and these types of things can be utilized. And in some extreme cases, people have even utilized drug pumps and opioid medications, but we're now learning that these types of medications are not effective and healthy to be taking long term. So I'd like to talk specifically about two treatment options that may have not yet been considered or tried in many people's situation. The first is radiofrequency ablation, and the second is spinal cord stimulation. Radiofrequency ablation is a very common treatment that utilizes heat applied to small areas of tissue to essentially help deaden those areas and lessen pain. It's a very common treatment that we use for treatment of arthritis pain of the spine. It's very safe and does not require any type of hospitalization. It's all done through small needles that it can essentially be placed under X-ray guidance into the area in question, and then essentially deaden that area by burning the nerve endings in that area. The only major disadvantage to this procedure is that it's generally not considered permanent. Those little nerve endings can sometimes regenerate, But if they do, you can come back and have the procedure repeated. Now let's talk about stimulation therapy, which is the main topic of our talk today. So who can benefit from spinal cord stimulation therapy? Stimulation therapy is very effective for people who have neuropathic pain or nerve pain. That can sometimes occur in people that have already had back surgery and still have nerve problems. Anybody who's had chronic pain has been treated by a pain specialist for over 6 months without relief in their pain. People who have pain in their legs, feet, and back. People who have specific conditions causing nerve pain, such as neuropathy, and CRPS and RSD. Those are very specific pain syndromes involving damage of the nervous system. And, is your pain greater than a 5 on average during your normal daily activities? Have you already tried the normal treatment modalities, including physical therapy, epidural injections, and even in some cases, radiofrequency ablation, as we just discussed? If the answer is yes, and you're still having pain, then SCS or spinal cord stimulator therapy may be considered, particularly in cases where surgery is not the recommended option. So a little bit about spinal cord stimulation. Stimulation therapy has been utilized for over 40 years. It's been FDA approved for that same amount of time. It's a non-drug therapy, which is very favorable. It is, even though it's considered a long-term therapy and is intended as such, it can be easily reversed. It's generally, stimulation therapy will lead to a significant reduction in the use of other oral medications, which can be beneficial, particularly if those medications have unwanted side effects. Stimulation therapy is covered by most major insurance plans, including Medicare and workers' comp. And because stimulation therapy is technology-based, it has seen a dramatic improvement over the course of time as technology in general has improved. So as a result of that, the stimulation therapy has become much more prevalent in the last decade or so. So how does it work? Spinal cord stimulation therapy works by applying small amounts of precise electrical current to specific areas of the spinal cord. And in doing so, it can block pain signals. So there is a trial phase for spinal cord stimulation. Once a patient has been identified as a suitable candidate, there is a trial phase that's set. The patient comes in to a procedure center. The procedure itself is the placement of the trial leads. That is very much like having an epidural injection. It's all done through a small needle. There's no incisions. It's done with local anesthetic. The trial leads are placed. There's a bandage applied over the leads. The leads are hooked to a temporary external battery that is activated and is programmed to customize the therapy to the individual. And then basically that person gets to go home and try this therapy out for usually around a week. And during that time, they get to see firsthand if the therapy is effective for them. So at the end of that trial phase, the patient will come back to the office and be reevaluated by the physician. And the things that are evaluated specifically are, did you have at least a 50% reduction in your pain? Were you able to perform your daily activities more effectively and with less pain? Were you able to reduce your medications during the trial phase? Were you able to sleep better? And so on. So these are all factors that are taken into consideration to evaluate as to whether or not you've had a successful trial. If in fact that is the case, then and you've had a successful trial, that person is a candidate for a permanent implant. The permanent implant process is very similar to the trial process. It's very minimally invasive. It is generally done in a surgery center, and is a same-day procedure that takes about 45 minutes, with the patient being able to leave the same day. The treatment itself is very customizable through programming, so it can address different pain areas of the body simultaneously. There's different different stimulation modalities that can be used, some of which create what we call a paresthesia, a warm, fuzzy, tingly sensation. Other modes of stimulation are paresthesia free. In other words, the patient doesn't feel them at all. Or sometimes we combine those therapies together to give the patient whatever seems to be the best treatment for them. Stimulation therapy has been studied extensively over the years and has been proven repeatedly to be safe and effective in clinical studies, with people seeing significant reductions in their pain scores even after several years, as this slide indicates. So what's next? Well, to really know for certain if you're a candidate or potential candidate for stimulation therapy, you need to talk to your physician, and that can be your regular family practice doctor, who can then refer you on, or see a pain physician directly. And listed on this slide is a website that you can go to, and that will give you a listing of the pain physicians in your area that do stimulation therapy. So that was very brief, but we wanted to give an overview of stimulation therapy, mainly to raise awareness of this potential therapy. This is something that we do perform here at Orthopedic Institute and have done so for several years. And we're very enthusiastic about this therapy and how life-changing it can be for people that have suffered from chronic pain. If you would like to be evaluated at Orthopedic Institute for as to whether or not you're a suitable candidate for stimulation therapy, you can simply call our main number listed on the slide here and make an appointment. You do not need a referral to be seen at Orthopedic Institute. And if you do call, mention that you saw the webinar event, as we do save appointment time slots for people specifically from this event.
If anybody has any questions, you can offer to the audience, and we'll take a minute to see if anybody writes anything.
Okay. If anybody has any questions, they can certainly submit those now, and we can hopefully answer those for you. One question that just came in: is this treatment, is it effective for neuropathic pain of the feet? And the answer to that is yes. Stimulation therapy is fairly effective at treating most forms of neuropathic or nerve pain. Certainly one of the things that we utilize it for is neuropathy or neuropathic pain of the lower extremities, feet, ankles, legs. So the answer is yes, it is very effective at treating neuropathic pain of the feet. Next question is everything internal when the process is over? The answer to that is also yes. So for the trial phase, the temporary leads, they are under a large bandage of tape. For the permanent implant, there is a small incision that is made and everything is put under the skin. So when it's all said and done, it's all internal, and so that no one would even know it was there. And also would allow you the ability to swim, be in the water, those types of things. Those are questions that people often ask, but it is all internal once it's completed. So the next question is, how does this work for arthritis of the knees for runners? And if you remember back on one of the earlier slides in this presentation where I talked briefly about the difference between neuropathic pain and mechanical pain, because the stimulator system is highly effective at treating neuropathic pain and far less effective at treating mechanical pain. Arthritis pain of the knees in runners is that is basically a mechanical type pain. So it's not as likely that stimulation therapy would be effective for that particular type of pain. Now, having said that, we also talked briefly about ablation therapy, radio frequency ablation therapy. I talked a little bit about that in how it relates to arthritis of the spine, but we also utilize the radio frequency ablation therapy in large joints, including knees. So we do have that option for people who have chronic knee pain that is not a surgical situation. They can have a radio frequency ablation of the nerves in the knee, and that can provide significant pain relief. But generally speaking, the stimulator is not probably going to be as effective as you would want it to be for that type of mechanical pain.
Is there a battery that needs to be recharged?
The next question is there a battery that needs to be recharged? The answer is yes. So the implanted battery is very similar to a pacemaker battery. It's about the size of an Oreo cookie. It's implanted through a small incision under the skin, usually kind of in the low back flank area. That battery generally has to be recharged about once every 1 to 2 weeks in most people. That is accomplished through an external charger that looks like a hockey puck, and it basically is placed on the skin over the battery, and it transfers a charge wirelessly into the battery. And that usually is about a 1 hour process every 1 to 2 weeks. People generally do it kind of at the same time every week or 2 weeks. Typically, watching TV or something of that nature, they'll place the charger over their battery and take care of their charging in that way. And those batteries will generally last about a decade before they need to be replaced.
Do I need a referral to see you?
The next question was, do I need a referral to see you? And the answer is no. You do not need a referral to see me at Orthopedic Institute. You can simply call the number on the screen, mention that you were at this event, and they will get you scheduled in one of the spots we've already saved for people who viewed this event. So the next question was, can I play golf and tennis after a stimulator? And I would say yes to that as well. So after a person has a stimulator implant, generally for about 6 to 8 weeks post-implant, we do have some minor activity restrictions that mainly involve excessive bending and twisting. So during that first 6 to 8 week period after an implant, I would recommend against golf and tennis. But once, and that's to allow the leads to heal in and be secure. Once you've gone past that healing phase, then I generally do not limit people from those activities post-implant. The next question is, can I have an MRI? And the answer is yes. In the past, these systems were not compatible with MRI scanners, but that has slowly changed over time. And basically now there are MRI compatible systems with all the different types of stimulator systems out there. So yes, you can have an MRI scanner after an implant. The next question is, does it help degenerative disc disease and a bulging disc? And yes, it can help that type of pain, or the pain that's caused from those conditions. And we do utilize it for those problems in situations where surgery is not recommended. So someone is asking, will it work for their low back pain because they have 2 slipped discs? It's very possible that it could. Again, the stimulator is very effective and most utilized for back-related issues. Certainly it can be used for other forms of nerve damage or nerve pain, but such as neuropathy. But a lot of the stimulators that we place are for people with back problems. The next question was, how effective after spinal fusion is this therapy? And I would say that depends on the situation, but one of the most common scenarios in which we utilize this stimulation therapy is in people who have had back surgery and spinal fusion. The next question was, will my insurance cover to come and see you? And I would say yes, that certainly would be the case. If there's any, we generally accept all major insurance brands unless you are a employee of Sanford or Avera and have their employee health plan.
How effective is it on thumbs and finger pain?
The next question is, how effective is it on thumbs and finger pain? That would again be dependent upon whether this is more of a mechanical degenerative arthritis situation or whether this is more of a neuropathic problem. We see both. We see people that have hand and finger pain from nerve injury or nerve dysfunction, and we see people that have the same types of pain from degenerative arthritis. And the stimulator is going to be much more effective at treating those neuropathic situations than it is just degenerative arthritis.
How long has this treatment been around?
The next question is, how long has this treatment been around? It's been around for several decades. I think the first implant was in the late 60s. About 1968 was the first implant. So it's been around a long time. It's obviously changed considerably over that time as the technology has evolved, but it has been around for a long time. So someone wanted to remind them or wanted me to revisit, how much does the temporary, what was the question? How long does the internal battery last? That's usually about 10 years. I've seen people go over 10 years, but that's a pretty good estimate, is about 10 years.
Any that you can think of?
How do I make an appointment?
Next question was, how do I make an appointment? The easiest way is to call the number on the screen, tell them you were at this event, and they will get you scheduled.
How long between the trial and the permanent?
Next question was, how long between the trial and the permanent implant? Generally, it's about a minimum of 2 weeks. The trial leads are pulled at the return visit. And once we've confirmed that the person had a successful trial, then we submit it to insurance for pre-approval. And that usually takes about 2 weeks. So it's usually about a 2-week minimum between trial and permanent. The next question is there more than just a battery that needs to be implanted? Yes, there's a battery and generally 1 to 2 stimulator leads, which are small catheter type, small catheters that are placed in the epidural space.
How do you deal with medication?
So the question was, will you then take my medications away? So that's really not, if someone comes to see me and to be evaluated for stimulator therapy that is on pain medication, through another physician, I don't interfere with that. Certainly, the goal would be to improve pain relief so that you can start to taper off those medications. But that's usually a discussion that we have after, several weeks after, or, even up to 2 months or so after the implant. Once everything's healed and we've optimized therapy, then we start talking about those types of things. But, that's between the patient and the prescribing physician.
Do the catheters or the leads last 10 years?
The next question is, do the catheters or the leads last 10 years? And the answer is yes, they last. They're intended to be permanent. So the leads will outlast the battery. So even, we have people that have had an implant and they get 10 years down the road and their battery runs out. We simply just replace the battery. The leads are left in place.
Do you have statistics on success rates of this therapy?
So the next question is, do we have statistics on the success rate of this therapy? And nationally, it's about 85 to 87%, depending on the area and the practitioner. Our general success rate is about 85 to 90%.
Thank you.
All right, thank you very much. I appreciate everybody logging in and listening to this presentation, and hopefully it was informative. And if you have any further questions, call and make an appointment. We can talk in person. Did one more come through?
No.
Okay. Thank you.